When we talk about LASIK surgery, we always talk about how wonderful it is and typically how well everyone does, and it is a remarkable procedure. But I always tell them, and especially in their exam, that it is a surgical procedure, and as with any surgery, there's always a risk. And so, while I don't like to dwell on the risk, I always like for patients to be informed. And as we talked about with any surgery procedure, there's a risk that there could be a complication. They're rare, but some of the complications that you could see with LASIK surgery would be obviously an infection. That's extremely rare. You're on antibiotics afterwards, but it's always a risk. And there's risk with glare and halo. That's always been somewhat of an issue, especially earlier on when we had earlier machines. I don't find that much of a problem anymore, although most people do notice them right afterwards, but it is something that always gets better with time, and for the majority of patients it goes away and doesn't interfere with their daily lifestyle. Dry eyes is another risk, and that's actually one of the more common things that you'll see after LASIK surgery is some issues with some dry eyes, especially right on from surgery. Typically they're controlled with artificial tears and some gels and sometimes Restasis or plugs, but for the majority of people it's a transient thing and goes away.